Good evening friends and welcome to my channel. So as you know, in the last video we have discussed 10 questions about the healing of the wound, and in today's video we will discuss another 10 questions that you have to answer, and you have to wait for the next video for the answers. So let's start with the questions. Why the phase 1 of healing of the wound is known as inflammatory phase? So you have to tell about why it is known as inflammatory phase, not any other name. Question 2 is, network of fibrin is formed over the wound in how many hours? So whenever there is a trauma, there is formation of the wound, events starts that lead on to the formation of the fibrin plug, and that you have to mention that how much time it takes. Monocytes, next question, that is third, monocytes begin to appear at the site of the wound healing by. So you have to describe on which day they start appearing at the site of the wound. It is not the exact time, but there is some overlap between the days, and you will find that by this day of the healing of the wound, these cells start appearing at the site of the healing. So question 4 is, what is the role of monocytes at the site of the wound? You have to give the logic why these cells appear at the site of the, what is their exact role and function. By the end of the first phase of the wound healing, new capillaries appear from. So during the second phase of the healing of the wound, new capillaries form, and you have to give the answer that from which cellular elements these new capillaries form. Next question is 6, mesenchymal cells change into at the site. So by the second stage, mesenchymal cells also start appearing at the site of the healing of the wound, and you have to give what exactly these cells change into and progress the healing of the wound. Question 7 is, phase 2 of wound healing starts to appear at and ends at. You have to give the approximate duration when it starts and when it ends. So question 8, what is delayed primary suturing? So as you know, whenever we find that the wound is there and it is a big enough that the healing will take place a longer time, so it is our tendency and temptation to suture the wound so that healing starts in a faster way. So, but many times when we examine the wound, we find that there are many things which are present in the wound. Either the margins are dirty, margins are dead, there are other foreign particles, dust is there. So in those cases, we have to wait for some time before we do the suturing. So you have to answer this, what is delayed primary suturing? So how much time you have to wait so that, and when it is appropriate to suture the wound. Next question is, name the elements required for the good healing of the wound. As we have discussed in the healing of the wound that there are various components which are required for the healing. You can say the raw materials which are required for the healing of the wound, and of these raw materials, few elements are also required during the stage of the healing. If the patient is suffering from deficiency of these, you can say the elements, so there may be delayed or non-healing of the wound, or maybe scar formation that occurs in the last stage, maybe weak scar will form. Now the 10th question is, which vitamin is essential for wound healing and how? So you have to give the answer for that, which vitamin is essential and why it is essential in the healing of the wound. So now we will meet in the next video with the answer to these questions, and we will also discuss about 10 more questions that may be related to the wound healing or may be related to some other topic. Thank you very much, and don't forget to subscribe and like my channel. Thank you very much.